the classical complement pathway. In the simple language, we'll talk about that what happens in the classical complement pathway. So in the classical complement pathway, what happens, guys? The antigen, I've already told you, some foreign antigen comes, antibody interacts up with this. Which antibodies? IgG and IgM, they can be there. Okay. And which is the first complement to activate? I already told you, C1 is the first activation which happens. This particular C1 is being divided up in three subparts: Q, R, and S. So firstly, it is C1Q, then C1R, and then C1S. That is there in this particular one. And this particular C1S later on goes and activate the C4, divide this into C4A, C4B. Okay, divide this into what? C4A and C4B. Important is that always this particular component C4A goes out, okay, of the cascade. So this particular one goes out of the cascade. Cascade means this particular cycle. Now, what is being produced up? C14B. That is being there. And this C14B acts on the C2, change up into C2A and C2B. Okay, this C14B, which is activated form, we can put that activated form like this by putting up this particular line over the C14B. This is activated portion. This acts on the C2 and changes it into what? C2A, C2B. Just now I told up that A part mostly goes out of the cascade. But here is an exception which can be asked to you. And what is an exception? In this, the 2B component is out of the cascade. Okay, 2B component is out of the cascade. And now what is being produced up? C1 4B 2A. C1 4B 2A, that is being produced off, and for showing up the activation you can put a bar like this over it. Now important is this, if you remember this particular small hack, then it is very easy to handle these all things. C1 4B 2A is the C3 convertase of the classical complement pathway. This is the C3 convertase of what? Classical complement pathway. Got my point? And if it is C3 convertase, which one? C14B2A is the C3 convertase. It will act upon where? On the C3. So it acts upon the C3, divides this into what? C3A and C3B. Now you tell me which will go out of the cascade? C3A will go out of the cascade, because as a rule, they only go, exception is only the C2 stuff. Okay, so which will be carry on? That is this C3B will be accompanying this 14B2A further. Okay, so what is being produced up now, guys? C1 4B 2A 3B activated form. Okay, this is what is termed as C5 convertase. This is what is termed as C5 convertase. And if it is C5 convertase, it will act upon what, guys? C5. Divide this into what? C5A and C5B. Okay, important is everything will remain that side, only this will go forward. And when this will go forward, it will activate the 6, 7, 8, 9 at one go. It will activate the 6, 7, 8, 9 at one go. And this is what is termed as the MAC. Okay, now you will say, sir, what is MAC? MAC is membrane attack complex. And this membrane attack complex will act upon the antigen. It will create the pores into the cell of this particular antigen, and all the cytoplasm is out. And this particular antigen, after this particular stuff, will be killed. Okay, this is the classical complement pathway. Got my point? Important is, if you know this, that this starts from C1, okay, which is subdivided into Q, R, S. Firstly, the Q is activated, then R, then S. C1S is forwarded forward. This C1 acts on the C4, divide the C4A, C4B. This particular C4A goes out of the cascade, C4B goes forward. Now what is being in the forward? C14B. This C14B acts on the C2, divide this into C2A and C2B. C2B is out of the cascade. C2B is out of the cascade, and what is being produced up? C14B2A. C14B2A. But if you know this particular hack, C14B2A is C3 convertase. If it is C3 convertase, obviously it will act upon C3. Divide this into C3A and C3B. C3A is out of cascade and C3B will go forward. And when it will go forward, they have this combination C1, 4B, 2A, 3B. Remember this, that this is C5 convertase. And if it is C5 convertase, it will act upon which fellow? C5. Divide this into a C5A, C5B. And this particular thing, divide up. And this is out of the cascade, C5A. C5B will go forward. At once, it will activate what? 6, 7, 8, 9. That is termed as MAC. This particular thing is termed as MAC. And this MAC will act upon this particular antigen. It will create pores into this and all the cytoplasm out. This is what is termed as killing by the classical complement pathway. And what is the activation? Antigen-antibody complex. That's interaction.